Hi there, Dr. Shelby here at Evolve Chiropractic in Woodstock. Did you know that a majority of Americans sit for their workday? So for their normal 8 to 5, 9 to 5 job, they are sitting. And of that workday, they are sitting 45% of their workday. That's not including the commute to get to work, the commute to get home, sitting with your family, whether it be watching TV, having dinner. We spend a majority of our lives sitting. So I have a lot of patients coming in with a lot of hip pain and lower back pain, which can often be attributed to tight or weak hip flexors. Now, there is a majority of reasons that an area in your body can be in pain. Two of the most common reasons being those muscles or the soft tissue in that area are either tight or weak, or a lot of times both. So today I'm going to show you a test to see, is your hip flexor tight and weak, or is it mostly just weak and we need to strengthen it? This test is called Thomas test. So all you'll need for this is a thing that you can lay on, that you can let your leg hang off of. So whether it's a couch, a table like I have here, or even your bed, as long as it's not too soft where you're sinking a lot in the bed there. This can be really helpful in determining what is the main cause of your hip pain. That way we can figure out now how to fix your hip pain. So for this test, what you're going to be doing is you are going to be needing to sit towards the edge of the bed. You are then going to lay all the way back. You can put your feet on the edge of the bed to begin with, but you do want to make sure that your hips or your butt are right at the edge there. Then you're going to take the non-testing side. So I'm going to be testing my right leg. I'm going to take my left leg and bring it up towards my chest here, okay? Now, what I'm going to be doing is I'm just going to be letting my other leg fall down. Now, for a negative Thomas test, meaning your hip flexor is not tight or the muscle is not shortened, you want your knee to be below your hip. So here you can see that my hip flexor is not tight. It's mostly just weak if I'm having a lot of hip pain there. Now, if your Thomas test is positive, what that means is your knee is now above your hip, or the leg doesn't fully hit the table here, which means your hip flexor is not only tight or the muscle is shortened, but it can also be weak. Like I said, a number of times when we are in pain, it is because a muscle is, again, either tight, weak, or a lot of times both. So not only do we need to stretch these areas, but we need to strengthen them. So follow along and see how we can help with not only tight hips, but strengthening weak hips as well. Try this test out. Your body will thank you.